So next is post-operative analgesia. It's 26. How would you approach analgesia following a surgical procedure? So analgesia is very important in post-operative care because it encourages the patient to mobilize early. That prevents the thromboembolic phenomenon, cardiovascular complication, respiratory complications, and also improve the patient satisfaction. And a suitable regime may include all are of simple analgesic, strong opioid, local anesthetic, infiltration, peripheral regional blocks. So patient should be frequently assessed using a reproducible pain rating scale, a 10-point scale where 1 is no pain, 10 is the worst imaginable pain. What is pain relief ladder? So it's a stepwise approach to controlling the pain where additional drugs are introduced until pain is fully controlled. The first step on analgesic WHO analgesic ladder is non-opioid drugs such as paracetamol and NSAIDs like ibuprofen. If this is insufficient to control the pain, the weak opioid drugs such as opioid, codeine and tramadol can be used. The final step of ladder involves the oromorph or morphine. At each step, the use of adjuncts like anxiolytics can be considered as well. If complete analgesia is not achieved with regular administration of drugs at one level, then patient should be moved up one level. So, what other drugs are used in the conjunction with the analgesic ladder? Anxiolytics, diazepam, antiemetics, cyclizine and ondansetron, and neuropathic pain, gabapentin, amitriptyline, and steroid dexamethasone and prednisolone. What is PCA? How does it work? Patient control analgesia allows the patient to administer intravenous analgesia when needed, avoids waiting for the nurses to give medication. Most commonly used with morphine, or sometimes it can be used with fentanyl. And the patient is given an initial loading dose, and then the patient self-administered bolus doses. Minimum dose needed for analgesia consistently without producing side effects is usually 1 milligram for morphine, and there is a lockout interval when pump will not administer dose to prevent overdosing. Usually 5 minutes. Lockout interval. What are the advantages and disadvantages of PCA? Advantages: it frees nurses to perform other work, empowers the patient to have control over their pain, and helps to alleviate anxiety, which in turn reduces the pain experience. Immediate and effective, and no injection is required. There is no pain from actual injection itself. Disadvantages: opioids may accumulate, and that's why oxygen should be prescribed alongside the PCA. Button can be accidentally pressed when it's not needed. Incorrect setup of the loading dose and lockout can lead to inadequate pain or relief of overdose. And side effects such as nausea, vomiting, itch are common and can reduce the usage of PCA with the consequence of inadequate analgesia. Thank you.